To illustrate how all the elements of the Joint Ventures program come together, let's follow a hypothetical patient's experience as he makes his way through Joints or Us, a joint replacement center program at a typical community hospital. The elements highlighted in the video are either deliverables provided to you in finished form or as a template on which to develop your own. Mr. Hank Hopalot is an active 72-year-old grandfather who is in generally good health and enjoys golfing, playing with his grandchildren, and tinkering in his woodshop. His knee has been causing him increasing discomfort over the past few years, and it's recently gotten to the point where the pain is stopping him from doing many of the things he enjoys. Reading through the paper one day, Mr. Hopalot spots a newspaper ad that catches his attention. At last, answers to your questions about knee and hip pain, free seminar. Mr. Hopalot calls the number listed in the ad and reserves his spot for the seminar. Upon arrival at the hospital, he sees a sign in the lobby advertising the seminar he's coming to hear. The volunteer directs him to the seminar location, and as he winds his way toward the room, he spots another seminar sign, confirming he's in the right place. As the seminar begins, the presenter reviews the major structures of the knee and hip using a large anatomy board, labeling the key structures and problem areas as she talks. Mr. Hopalot is particularly interested in the X-ray panels being passed around that help to explain degenerative changes in knee and hip joints. As the seminar concludes, he understands the need for a good diagnosis and makes an appointment with one of the orthopedic specialists represented. He takes the VIP sticker with him and plans to hand it to the receptionist at the surgeon's office. The next week, Mr. Hopalot walks into Dr. Kelly's office and hands the receptionist his VIP sticker, which is promptly placed on his chart. While he waits for the doctor, Mr. Hopalot notices the brochures displayed in the office and takes one on osteoarthritis. Dr. Kelly picks up Mr. Hopalot's chart, notes the VIP sticker on the chart, and enters the exam room. After the examination, Dr. Kelly determines that Mr. Hopalot has end-stage DJD, and the best option for long-term relief will be a TKR. He asks him to watch a video that will explain the basics of the operation, and when the presentation is over, he'll come back to answer any questions Mr. Hopalot may have. Mr. Hopalot decides to have his TKR at Joints or Us with Dr. Kelly. Before he leaves the office, he receives the patient guidebook, Notebook for Knees, that will be his guide through the entire program. Mr. Hopalot and his wife drive to the hospital the afternoon before his procedure and get settled in his room in the area of the orthopedic unit dedicated to the care of joint replacement patients. He and his wife note the Wall of Fame display with the pictures and titles of the staff on the unit. They also stop to look at and read the many wall displays located around the unit that help to answer many of their questions, as well as set expectations for a quick recovery. Just after dinner, he attends a group meeting with the other patients and their families and watches the video, Welcome to the Hospital, which helps explain what will happen in the next 18 to 24 hours. After the group teaching session, the patients return to their rooms, relaxed and ready for the big day. The morning of the surgery arrives, and Mr. Hopalot's nurse, Sally, prepares him for the holding area. Sally notes on the nursing care card for day of surgery, which is conveniently displayed in an acrylic card holder, that she is to wrap the surgical leg in a sterile towel after the HibaCleanse scrub is performed. Mr. Hopalot's TKR surgery goes smoothly, and Dr. Kelly fills in a few variables on the operation report template, which saves him from having to dictate the entire report from scratch. He then calls Mr. Hopalot's wife, who's waiting in the activities room, to let her know that Mr. Hopalot is doing fine and will be back in his room in about an hour. Mr. Hopalot returns from surgery, and while resting, his wife reads the daily Knee Note newsletter that highlights what's to be expected that day including the importance of deep breathing and coughing, and the need to drink plenty of fluids. In the morning, Mr. Hopalot has his knee dressing changed, is dressed in a pair of shorts and a t-shirt, and is assisted out of bed to a comfortable recliner chair. While eating breakfast, he's handed today's knee note, which informs him that there will be a group exercise class this afternoon. Right after breakfast, Dr. Kelly comes in to do rounds and is greeted by the charge nurse, Becky. All the charts for Dr. Kelly have a special physician progress note that is partially filled in by the nursing staff. This form brings together the information important to Dr. Kelly and the other surgeons onto one document, reducing the time needed with the chart and allowing the surgeons to spend more time at the bedside. After lunch, all the patients are brought into the activities room for their first group exercise class. This is a fun time for patients and staff, and families are invited to take part in helping with the exercises. Once the class is over, Mr. Hopalot ambulates in the hallway and makes it all the way to Texas, one of the wall displays in the Walk Your Way to San Francisco series, designed to add fun and interest in meeting ambulation goals. He returns to his room for a well-deserved rest. The next morning, Mr. Hopalot again gets dressed in a t-shirt and shorts, has breakfast, and reads the latest knee note, which promises a special visitor later today. He attends a morning group exercise class, then a special buffet lunch in the activities room, along with the other patients and their families. After lunch, the second group exercise class of the day is followed by an exciting golf putting contest, won by little Mrs. Pennyfinch, who sinks 6 putts in a row. Late in the afternoon, the special visitor, a hairdresser, arrives to wash and blow dry Mr. Hopalot's hair. "I feel great," Mr. Hopalot says to his wife, who now joins him for a special gourmet meal of steak and lobster and a glass of wine. The next day, during the afternoon group exercise class, Mr. Hopalot and his fellow joint replacement patients watch the video Going Home and learn about what to expect and watch out for during the first few weeks at home. After the class, Mr. Hopalot receives his discharge information, including prescriptions, follow-up appointments, and a unique Homework for Knees kit. This kit, which contains 2 videos and a pamphlet, helps to ensure the continuity and consistency of the program once a patient leaves the hospital. Mr. Hopalot and his wife say goodbye to all the wonderful staff at Joints R Us and are on their way home. Before Mr. Hopalot's chart is filed away, the charge nurse circles a few variables on the discharge summary template, which is then transcribed by medical records into a narrative discharge summary, ready for Dr. Kelly's signature. This small step greatly reduces the hassle factor for Dr. Kelly and the other surgeons using the center. Yet another way, the program makes it easier for the physicians to bring their patients to Joints R Us. Mr. Hopalot is faithfully doing his exercises while watching the exercise video provided in his Homework for Knees kit when the telephone rings. Sally, his favorite nurse at Joints R Us, is on the line and wants to ask him a few questions about his experience. This patient satisfaction survey is key to developing a culture of customer service among the caregivers at Joints R Us. By having the nurses at the center talk directly to the patients about what's important to them during their stay, it focuses the entire staff on meeting those needs. After telling Sally how wonderful everything was during his stay at Joints R Us, Mr. Hopalot returns to his exercises.
Great shot, Hank.
12 weeks after his knee replacement, Mr. Hopalot is back on the golf course. And this time, he doesn't need a cart. As you have just seen, the Joint Ventures program includes literally everything you need to create and unite all of the elements for your joint replacement program. More importantly, Joint Ventures accomplishes this clearly in the eyes of your customers, your patients, and surgeons. From advertising to patient educational videos, brochures and wall displays, from operational tools and practical streamlining techniques and systems, all along the continuum of care. Joint Ventures is quite simply the best disease management program in the world today. Make Joint Ventures the cornerstone of your joint replacement program.